What I see anecdotally is that if somebody is able to engage with some mental health support, whether that be individual therapy or group therapy, you're a home therapist, anything like that, there are better outcomes.
Hi, this is Patrick.
And this is Laura.
And you're listening to This is Cancer.
Brought to you by Siteman Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis. National leaders in cancer.
We're joined today by Dr. Jessica Vanderlyn. Thanks for being here today.
Thank you for having me.
You've been on the show before, and we are thrilled to have you back.
I'm really happy to be back. We get to talk about some really important things.
Jessica, I am so glad that we are doing this episode. The last time we spoke was during the survivorship episode. We talked a little bit about mental health, but we didn't spend an entire episode dedicated to it. So
I feel like you could spend a whole season on mental health.
We could do a whole podcast on
Just
cancer
on
mental
that.
health.
Yeah. And so let's remind everybody who's listening who you are and what you do at Siteman Cancer Center.
I'm Dr. Jessica Vanderlyn, a clinical psychologist at Siteman. I manage our psychology service, so treating patients who have had cancer, who have cancer, and their caregivers for mental health concerns.
And I remember when we last spoke, you said you wish there was a mental health on every corner of every street in the United States. So we know how important mental health is in general. I go to therapy weekly, and I have never had cancer, so I can't imagine what it would be like to go through cancer and the trauma of it and try and figure that out and all the emotions that come with it. Patrick, you know way more than I do.
Well, I mean, therapy is hard enough as it is, and then you're also going to have to deal with all the other stuff. You can't be like, well, let me pause right there because we're here about cancer, so I don't really want to hear about how your mom was tough on you growing up because I'm sure you're having to treat the whole person, and then you just have this wicked curveball of cancer on top of that.
Exactly. So we do, of course, treat the whole person. There's nobody shows up to cancer without a history, without family, without some sort of experiences in their life. So we do have to treat all of that. Our service is specifically cancer related, so we try and keep it to cancer. But just like the example you gave us, we can't. There's an entire person and an entire life there that we have to take into account. And then as far as specialization, so as a psychologist, obviously I have training in mental health care and kind of how the brain and mind works. But yes, we also have special training and education in oncology specifically. So it is a very specialized field.
So let's talk about the trauma of a cancer diagnosis. And I don't even know if most people even think of it as a trauma. I mean, maybe I'm sure people that have gone through it do. Maybe they don't. But it is a traumatic experience.
It is a traumatic experience. So the definition of post-traumatic stress disorder, post-traumatic stress symptoms, and trauma in that diagnosis requires there to be a life-threatening situation, so a traumatic event. There's actually a conversation whether or not cancer is that traumatic event. I think it is. That's not necessarily how everybody views it. But that is a life-changing, troublesome event that does that does make you question your safety, right? Like any other traumatic event as we define it. So yeah, cancer can be a traumatic event. Absolutely.
So before we get into the nitty-gritty of what you do on a daily basis, I wonder if maybe we just take a step back and just kind of get the background on how long you've been doing this? What got you interested in it?
Yeah. So when I went to get my doctorate in psychology, I wanted to be a clinical psychologist, meaning I wanted to work directly with patients. And I had a great interest in the kind of overlap of health, medical, and mental health. So that was an interest of mine right away. That's what I specialized in graduate school. And then one of my early trainings was at a psycho-oncology service, and I just fell in love with it. I love the people that I worked with, the staff, like the teams of people in psycho-oncology are just fantastic clinicians, empathic people, and just a pleasure to work with. I think we all love what we do or we wouldn't be in this. It's tough work. So then I sought more training on that. My internship, my fellowship were both in psycho-oncology, and that's what brought me here to Siteman. And I've been in it for 10 years.
Wow.
Yeah.
That's awesome.
So I would imagine even in 10 years, you've seen a vast change in people that are realizing that this is something that they really need to talk about because for generations, they weren't.
Yeah, for generations, cancer was taboo, or it was something to be ashamed of even. So probably in the 70s, 80s, that started to change. But that has changed so much in the last number of years. And same with mental health. So mental health is kind of is behind that. I would say in the last 20 years, we've seen more focus on mental health and cancer. And I just see that growing and growing because there's clearly a need. We recognize that this impacts somebody's mental health, and we recognize that mental health impacts physical health and well-being too. So that's become much more normalized, which I greatly appreciate. Anytime somebody wants to talk about mental health outside of cancer or having to deal with cancer, I'm happy to talk about it because it's something that we all deal with. And it's there's no need to, push it under the rug or ignore it or be ashamed.
Just doesn't make sense.
No.
To stigmatize something like therapy, because I feel like it's so obvious that to prioritize mental health does not mean that you are mentally ill or unwell. It's not like if you're engaged in therapy, it's because you have problems. I mean, like Laura and tons of people ever since I've gone through cancer have been like, you should probably think about, looking into this. So I started therapy months ago, and it's incredibly, it's helpful, but it's not like some mystical. Most of the time I'm just venting, it's just a venting session to someone that's not my wife or a coworker.
I would argue that your therapist, I don't know who this is, obviously, but I would argue that your therapist thinks of it as more than venting.
Yeah.
But
sure.
For you, right, you're going in there and it's not scary. It's not intimidating. No. Nobody's kind of picking apart your ideas or thoughts or feelings. It is about getting something out verbally that you've been holding inside for some time. And I agree, it should be really normalized. It doesn't mean you have to have a mental illness to seek therapy. Most people in therapy do not have a mental illness. We see doctors for checkups all the time. That's pretty normal and expected. So why is mental health care different? I don't know, but I wish it weren't.
I'm curious about some of the things that we mentioned this a little bit the last time we spoke with you, but the things that people come to you that some people never think about that people go through when they're going through cancer treatment. Because I was like, I never really thought of that. And then you probably were like, yeah.
Well, and there's some stuff that one person might think of that another may not. So, really just curious about the whole gamut of things that you have to help people walk through.
Okay, well, I'm excited to share a lot of that.
I may start taking notes here.
So most typically we treat things like depressive symptoms and anxiety symptoms. Those are pretty common or somewhat common in the general population and very heightened in cancer populations. And it's likely that somebody, even if they don't have a diagnosis of anxiety or depression, will experience symptoms of it. So maybe like a sub-threshold anxiety or depression. We also often treat things like fatigue, pain, and sleep. Those are a lot of the time not seen as a mental health focused treatment, but they really are. So a lot of studies show that mental health as well as some behavioral changes are most effective in managing those. And those are all side effects of cancer. All of this really is kind of a side effect of cancer. And patients are really good at, for the most part, thinking about and talking about physical side effects. So if they're nauseous through treatment or have some pain, they're pretty good at telling their oncologist about it and getting treatment for it. Same should go for the mental health aspect or the cognitive or emotional aspect. These are kind of side effects of treatment. So speak up, and we can probably do something to help. We may not be able to eliminate it, but we can help you through it.
So what would be something that you would tell someone if they're suffering from depression or anxiety, which is very similar, each of those?
There are a lot of overlaps, but they all are also very different. But they often coexist too. So it's very common for somebody to have depression and also an anxiety or a kind of anxious demeanor, or somebody to have anxiety and that has brought down their mood. So I'll start with depression. Depression means that somebody has had for at least 2 weeks a low mood and really has lost some enjoyment or lack of interest in some things that they typically enjoy, as well as some other things. So often changes in appetite, changes in sleep, irritability, kind of slowed down or agitation. This is super common through cancer. So in the general population, about 10% of people have depression throughout their life. In oncology, it's 25%. So 1 in 4 people.
Gosh, I would think it'd be even more.
If we think about symptoms, yes.
Yeah.
We generally say that up to 80% of oncology patients have symptoms of some of this. But as far as a diagnosable depression, 1 in 4 have it, which is a lot. Yeah. If you think about, all the people in the waiting rooms, or if a doctor thinks about all the people that come in their clinic every day, 1 in 4 have depression currently because, and kind of partly due to their cancer. So one thing that's super helpful in managing depression is staying active and engaged in things that you enjoy. So we call that in general behavioral activation. And that means you might want to have a list of things that generally are enjoyable to you. Doesn't mean it feels great right now, but I want you to continue doing them. I want somebody to continue doing those things that bring their life meaning, that they enjoy, that help them to relax or make them laugh. So often that's like movies or going outside or spending time with friends or coffee. I love coffee. You know, any little thing like that you typically enjoy, plan and schedule that into your day and make it a habit, even if it's not feeling great. So that's often step one in managing depression.
And what about anxiety?
Anxiety is huge in cancer. Again, that's, up to 80% of people are having experiences of some anxiety, may not be diagnosable. And the numbers are similar. So in the general population, 8%, 6% have anxiety, and then in cancer, it's at least doubled, which I think is very low. I thought it would, I anecdotally think it is much higher. But as far as managing anxiety, talk therapy is obviously one of the best things to do because it's about being stuck in this thought and this cognition. And without help getting out of that thought, that kind of spiral, we just get stuck there, which is just how the brain works. So sometimes something somebody could do in a moment like that is to think about, well, how do I know this is true? So if the anxiety is about a scan, and we can talk about scanxiety too.
For sure.
If anxiety is about a scan, well, really, what's the evidence? The last scans that I had, they were clear. So it's likely that they're going to be clear. We'll talk about it. I know. It doesn't work as well as it should be, as well as it should. Or if it's something else, what's the likelihood of this to recur, or what's the likelihood of my treatment working? Well, you do have information. Your doctors have given you data there, so you can rely on that a bit. It doesn't fix the thoughts. That's just a way to kind of manage them. Another kind of cognitive trick that we can do is, what would you tell a friend in this situation? So if a friend came to you with these thoughts that you're having and was expressing this, how would you reassure them? How would you support them? What would you say? Would you say, oh, you're wrong, this is dumb? No. They would say, oh, this sounds really scary. Period. And so maybe just kind of treating yourself like you would treat a friend is also a good way to manage some of that. Anxiety is really, really tricky, though, especially through cancer.
God, I'm getting anxious.
I know.
Right now.
Someone gave me the best definition of it. Not the best, but one that I could really understand. And it was from my daughter's therapist. She said it was overestimating the risk of something happening and underestimating your ability to handle it.
Ooh, I think that second part of that statement is really important. Usually in therapy, we focus on that first part, that overestimating the likelihood of something to happen, which in cancer is unique. So if I tell somebody, well, it's unlikely that your scan is going to show that disease has progressed because X, Y, and Z. Yeah, but that already happened to them. The worst already happened. So it doesn't feel like this is a fair comparison. So to be able to kind of challenge those thoughts sometimes through cancer may just feel invalidating. So I like that second part of it where you're underestimating your ability to cope with it.
Yeah.
So that might be a great strategy in dealing with anxiety around cancer is, how have I dealt with things before? I've gotten through everything so far, right? What have I relied on that has helped me? How have I coped with stressors in the past? And just reminding yourself that you do have ways to handle these things. As a human being, we all have coping skills, and you can build those a little bit more.
Right.
Yeah. It's, I don't know, the anxiety, the scanxiety will always be a huge thing.
Yes.
Let's just hit that now, Patrick, because we know it's been so prevalent, and especially in this last year, some of the scanxiety that you've dealt with.
I mean, there's been a lot, and since I've had cancer, there's been a lot. I mean, first off, every scan brings anxiety.
Yep.
Just does. And, you get through them, and I've racked up a lot of consecutive ones, and I try to think, I try to keep in mind, hey, the last one was good. Why wouldn't this one be good? There's all kinds of things that will creep into your mind that I'm sure is different from person to person. But, I mean, the main thing that happened over the last year is, I went and had a scan, and I see those words on the report, new lung nodule. Now, I already know that sometimes people can have lung nodules and that they can go away. However, to see a new one on a CT scan for a patient with a history of lung cancer, knowing that lung cancer usually recurs within 3 to 5 years, and I'm around 4 years. I mean, to me, that was like, there it is. Like the judge had slammed the gavel. Yep. You know, that's what I saw in that report. Fortunately, I'll rip the Band-Aid off. You know, it wasn't cancer, but you know, my oncologist was concerned, the radiologist was concerned, and we had to wait to see if it would go away, which sucked. Maybe it was allergies kicking up or a cold that I had or whatever, but good God, right. It's terrifying. And we've got our first child on the way. My wife's going to have a baby in like 2 weeks.
Congrats.
You know, and you don't want to tell her, but you can't hide from her. And it just kicks up all these things. I got to tell my family again now. Like, it was awful.
That's very normal. That's absolutely normal. It would be less normal to not think that way.
He did not tell me about this latest scan. I was very, very mad at him. He said, I just want to let you know. And I was like, if you ever, I didn't want to burden you. And I'm like,
I'm tired of burdening people with this stuff. I really am. I'm trying to get better at handling it. Not like white knuckling it. Mm-hmm. Just not spreading it to everybody in my inner circle just because.
But what if you would have been like, hey, I'm sorry I didn't tell you, but I have lung cancer and it's back. I'm like, what do you mean you didn't tell me? Like that's
how I tell you, I guess. I don't know.
I know it's not his problem to worry about me, but that also is like, why can't you think that I can handle hearing that you're worried or scared?
Because a lot of people can't.
I can.
This is such a like normal conversation.
Yeah.
I know that we came in here for, you know, to have a podcast, but just you expressing what you went through with the scans, it's such a normal conversation. And then this interaction of friends or loved ones or caregivers or anybody in your family or friend group. And that kind of, how do I tell somebody? Do I not tell somebody? And then feeling hurt that you weren't told. That's so normal. Mm-hmm. And that's not even what we're here to talk about today, right? There's so much that is impacted by cancer that is outside of the medical setting that we just, I think, need to pay more attention to.
What advice would you give for family members that have someone in their life going through cancer and they're just like begging them, and do they feel like, you know, they can't trust me with this information? Like, how do they not take it so personally? Because it really isn't. I always have felt like with people that I love in my life that have gone through it, it's not about me. It's about them and what they need. So how can you impart that to people loving someone through cancer?
So for the caregivers, I would say, you know, open the door and then just leave it open. So, you know, it may be like, hey, Patrick, next time you have a scan, I'm happy to hear about it, but you're welcome to tell me whenever you're comfortable. I'm just here. And that's it. And then, you know, it's up to the person with cancer, the person with the cancer history to do what feels right for them. But yeah, for the person receiving that information, it's easy to say, don't take it personal, but really don't take it personal. It's really not about you or the relationship. It's about what the person needs at that moment. So really the best thing you can do is open the door and just kind of be there.
So we talked about depression and anxiety, and we did touch a little bit on PTSD, but tell me more about kind of what that is, what that looks like for a patient, and something you could give for advice on dealing with that.
So PTSD is very complicated. A lot of people through cancer, up to 80%, do have post-traumatic stress symptoms, but not a full diagnosis of PTSD. That's important to recognize, and also treatable. Somebody doesn't need to have a full diagnosis of PTSD to benefit from therapy for trauma. So in the general population, like 4% of people have PTSD. In cancer, it's up to 80% of people are experiencing these symptoms. So it is, you know, 10 times, more than 10 times what it typically is.
Yeah.
And we typically see PTSD in veterans, right? People who have been in combat or people who have had violence against them. Cancer is also traumatizing. Like I said earlier, that is for discussion. Some people disagree, but I think it is a traumatizing experience. So through cancer, if somebody has a history of trauma, and also younger people are more likely to develop post-traumatic stress symptoms. That's just been seen in the research. So those are two kind of things that we need to be aware of when working with oncology, that, you know, if somebody has a history of trauma, maybe we should ask about this. We don't have to get into it. But do you have a history of trauma? Because this may be re-traumatizing. And then in PTSD, we see a lot of kind of re-experiencing. We see hypervigilance, which is a little bit of what you're talking about, being very aware of your body. But that might be like a more startle response. Or hypervigilant about any kind of functioning or change in your body. Also avoidance. So I think that's one of the most important reasons why we need to talk about this in cancer is people avoid the hospital. Right? You avoid going to appointments, you avoid taking medication, you avoid talking about it, you avoid follow-ups because that feels safer. Obviously, it's not, right? Following up with your care is safer and better for you. But with PTSD or a consequence of trauma is often avoidance. So that's one of the reasons why we need to think about this. And then as far as treatment for PTSD or post-traumatic stress symptoms, sometimes just talking through the trauma, processing it, is enough, but there are a lot of specialized providers who treat PTSD. That's typically something that I wouldn't want somebody just to suck it up and deal with on their own. It's typically something that you would need a little help with.
Yeah.
So we talked about depression, and one kind of component of depression that we haven't talked about is suicidality. It's often a part of depression. It may be very passive, the idea of wishing for death or hoping that you not wake up, or it may be more active, somebody wishing to end their own life. Those happen through cancer and through depression. I don't want to pretend that that's something we shouldn't talk about because it happens. So getting mental health care is one way to treat that. There's also emergency lines throughout the country now. It's 988. Somebody dials 988, and they are directly connected with a crisis person in their area to address those concerns. So I don't want anybody out there thinking, one, these are thoughts that they shouldn't be having, or there's something wrong with them for having these thoughts. And two, I don't want anybody thinking there's no help. It's hard to get in for therapy appointments sometimes. It takes a little time. But you can make that appointment and then call 988 if you need some help right now, and people will get you support that you need. Those people on the line for that crisis line are excellently trained in helping people through those feelings.
You mentioned sleep and fatigue. When I think of fatigue, I think of, when someone's going through, I know you were tired a lot, Patrick. I've had friends that are tired, but some people probably have the opposite and can't sleep. Tell me more about the fatigue and what kind of treatment or advice you would give to them.
Oh, man, when you're so tired you can't sleep.
Or you're on steroids with treatment.
Oh.
Yeah, that's rough. So often there's both ends of the spectrum, right? Somebody has a lot of cancer-related fatigue, but sometimes through treatment, you're so tired or keyed up that you can't sleep, so kind of anxious that you can't sleep, or steroids are impacting sleep. But fatigue is very real. Fatigue is more than being tired. It's being tired and exhausted in a way that's past what would be expected with the amount of exertion. So, if you ran a marathon, of course you're going to be tired and exhausted. But if you're coming to sit in a desk and talk with people throughout the day and you're feeling physically exhausted after that, that doesn't quite add up. So cancer-related fatigue is often due to the cancer or the side effects of treatment. And it really is that being tired past what would be normal. And the first-line treatment for fatigue is actually not medication. A lot of people think that it is. A lot of our oncologists or medical providers prescribe medication for fatigue or to increase energy. Those all have a place, but really the first-line treatment is a psychological and behavioral kind of not necessarily exercise, but movement intervention. And that can be done in just a couple weeks. It's about changing how we think about fatigue, how we think about ourselves, how we think about the body image, but then also making some habitual changes in how we're working. So if somebody's dealing with fatigue, that is something that really you don't need to just suffer alone with. You can even Google some resources. I'm not a big fan of Google and WebMD and all of that, but there are some great resources out there for cancer-related fatigue.
You mentioned something the last time we talked, which really connected with me because I had back surgery 20 years ago. And when I had a ruptured disc, I could do nothing. It was so mind-numbing, right? Mm-hmm. Pain management for cancer patients before, during, after has to be a massive part of a massive drain on them, right? So and then that affects your mental health.
Yep.
How do you even begin? You can't take the pain away sometimes. So how do you even?
You're right. We can't take the pain away sometimes. There are medications that do that, but oftentimes people do not want to take those medications, or they're really not meant to be used long term. And again, similar to fatigue, some of the best interventions or best treatments for pain are actually psychological. So we're changing the way that somebody's interacting with or thinking about their pain. And I don't want that to sound like it's in their head. It's not that. That's not at all what I'm saying. But how we think about how we interact with the pain actually changes how we function. So if all you're thinking about is, I'm in pain, I can't do the things that I like to do. When is this going to end? I feel miserable. Then that kind of pulls you down. If you're thinking, I feel miserable and I have no idea when this is going to end. I'm not doing everything that I like, but I can still do this, right? That's a little change that you can make that does improve daily life. So when we think about a lot of little changes like that, usually in how we're thinking, that's what pain treatment is like. Often that is in conjunction with medication.
So do you feel like you have to keep telling people how important this is, or do you feel like we're getting somewhere now?
Both. I feel like we're getting somewhere. Like I said, mental health and cancer has grown tremendously in the last 20, 30 years maybe. Siteman pays a lot of attention to it. I think we realize that comprehensive cancer care is not comprehensive if you're not actually treating mental health through it. So I think that's well understood and known. But as far as all the things that we do, no, people generally don't know that. People are referred to us and then we ask a lot of questions and decide, oh, this is what I think would be helpful for you, or this is how I can help your sleep or fatigue. And then we'll move on to working on the anxiety, or vice versa. We come up with a good treatment plan to manage whatever it is that they're presenting with. But often people don't know all the things that we do. Often as a mental health provider, you think about depression, anxiety, PTSD. We talked about that already. That's a big piece of it. But there's so many other things: communication, fatigue, sleep, pain, body image, and more. A ton of stuff.
Well, I know we didn't mention these off the top of the show with the list, but can I ask about, like, what if you're a parent and you're going through this? Do you have any tips you could give to someone that's trying to focus on their treatment but also still be a present parent?
It's hard. There's often not enough time and energy in a day to do everything at kind of 100% like you might be used to doing. So one suggestion I have is to accept help. That may be from other parents at school or family members or somebody in your neighborhood, picking kids up from school, packing lunches, picking kids up and taking to soccer practice, all of those things. You have a lot of people probably in your corner that can help with those things. So ask somebody specifically for a specific type of help. I definitely recommend that. Also, if you have kids, there's always some conversation around a conversation with them. How do I talk to my kids about cancer? What do I say? What don't I say? There's a lot of great research on this. I can touch on a couple things. It's important to use age-appropriate information. So typically that means using the word cancer. You know, if somebody's very young, you may say mom is sick or mom has a disease. You might not understand what cancer is specifically, but we do recommend you use that word for the most part. And kids also want to know what's going to change. So you might use the word cancer and say somebody in the family has cancer, they're going for treatment, they get medication. You might be more specific if somebody's a little older. But how is that kid's life going to change? That means I'm not picking you up from school every day anymore. We're going to have neighbor Susie do that, or whoever it is. That means I'm going to be a little bit more tired sometimes. So when we hang out, I might be watching TV with you more than we usually do. Stuff like that. You want to give them some specifics about how their life is going to change. There's also great therapists out there for kids. That's always an option. At Siteman, we recommend our parents who are patients can contact St. Louis Children's Hospital or their pediatrician for some great support for the kids too.
Yeah, and spouses, I'm sure it's difficult too on marriages, like having to take on new roles, or how one person might deal with the diagnosis is different than how the other person would deal with it.
Absolutely. Those different roles in marriages or any sort of partnership are a huge part of cancer treatment and kind of survivorship. We could talk about that for an hour probably, but the roles significantly change. Mm-hmm. Somebody is not usually used to being an independent or needing care role, and it changes, maybe temporarily, but it does change, and that can be really uncomfortable for the dynamic of the relationship. Kind of like we talked earlier about just communication in general, it's helpful to be open about it, to say, hey, our roles have changed. I'm noticing that I depend on you now for these things that I didn't used to, and I don't like it, but thank you. Mm-hmm. And I'm noticing that I could actually do some of these things that I wasn't doing before. So maybe somebody's doing a lot of kind of stuff around the house, like housework, changing light bulbs, laundry, mowing the lawn, all that stuff. Physical activity that somebody with cancer may not want to do or be able to do as much of anymore because of that fatigue. But maybe they could take on a different role of like paying the bills, mm-hmm. all the stuff that's paperwork or something like that. So just outlining it, communicating about it, being very clear with each other, whether it be in a partnership, a marriage, or family relationship, right. or coworkers even.
With general overall coping with going through the day-to-day of cancer treatment, mm-hmm. is there any takeaways you can give to someone listening?
Yeah, I think general coping skills that I would encourage most people to use would be to manage their energy. So that kind of fatigue or activity management, it's going to be different than your day-to-day life prior to cancer. You have to give yourself a little extra grace, knowing that you may not have the energy day-to-day that you did before. And that may be very temporary, but right now in cancer treatment, you're likely going to have less energy, both emotional and physical energy, and that's okay. So to kind of pace yourself, look at your week and say, what do I have scheduled? What do I need to get to? What's going to take energy and time? And then prioritize. If spending time with your family is most important, then maybe the laundry is not going to get done that week. You can ask for help or maybe just let it go that week. That's fine. You have to manage and prioritize what's most meaningful to you. So I would say that's a really good coping strategy, both with emotion and physical fatigue. Also, processing information. So generally, that's what therapy is. So it's not just venting in therapy, it is processing in therapy. But that's really helpful. That means kind of talking through your thoughts and feelings. Sometimes it just comes out like a bunch of mumbo jumbo. We don't even know what's going to come out and we just say it. Or sometimes it's like journaling or any sort of kind of expressive art might be a way to process it too. So I definitely recommend that. Anytime we can process something, it's better than holding it all inside. If you have somebody to talk to, great. If you have a mental health care provider, great. If not, you can find one or you can do some of that on your own, like I said, through journaling or something like that. And then also just building some good strategies for like relaxation or soothing or taking care of yourself. So that might be like a mindfulness practice, or if you'd like to take baths, make sure you're doing that, or getting good sleep, just those basic physical care pieces that we sometimes ignore, but those are essential.
Do you find that if people start getting some help or anything when it comes to their mental health, when they start their cancer journey and throughout it, that they have better outcomes?
There are better outcomes if somebody has mental health support through cancer. That has been evidenced in research many, many times. What I see anecdotally is that if somebody is able to engage with some mental health support, whether that be individual therapy or group therapy or going to any one of these other kind of books that we talked about, or your home therapist, anything like that, you're going to be more equipped to deal with what's coming up. So there are better outcomes both in cancer, but better outcomes in quality of life. You're functioning better. You're enjoying things again. You're managing your fatigue so you're not losing that energy so rapidly. Kind of like you talked about the definition of anxiety that you used, the over kind of emphasis on the intensity of something and your under emphasis on your ability to cope with it. I'm not sure if those were your exact words, but we want to add to your confidence and your ability to cope with whatever is coming.
So you're treating your whole self.
Yes.
Yeah.
When someone finds themselves at Siteman and, maybe their physician or their oncologist mentioned these services at one point and, they took note of it and, a month goes by and now they're struggling. Like, what do patients at Siteman do? How do they get involved with this? Like, what does it look like when you're literally going in there going, well, I heard on the podcast this, how do I get involved in this? I feel like I need this.
So your physician can make a referral. Any Siteman patient can see us for cancer-related distress. And often that is physician referral. So they put in a referral. It's all behind the scenes. And then we call them and ask them questions about what the needs are to get them to the right service. So it doesn't mean that if somebody's referred to us that they're going to see me for individual therapy. There may be something else that we'd recommend. So we have a lot of therapy groups that are fantastic. There's a lot of evidence that shows that actually therapy groups can be more effective than individual therapy in certain cases. And cancer is one of them because of the feeling alone through it. And it's nice to see other people that have been through it and learn from them and support each other. So there's a lot of things that we can offer. Sometimes we refer out for other things. Sometimes there are some national organizations who do great work too. So there's a lot that we can choose from. But once somebody's contacted by us, that's when we start to ask the questions and get them connected. So back to your original question, it could be a referral from your physician. You just need to ask somebody in the team, ask your nurse, ask your doctor, ask anybody for a referral to the Siteman Psychology Service, or if you're at another cancer center, a referral to their mental health clinic if they have one. And patients can also call us directly. So sometimes through PAM's service, the Patient Coordination Center, sometimes patients call there and are talking about their mental health, and then they get a referral from one of the people on that team. Or patients can call us directly. The phone number, I can give it. The phone number for our service is 314-747-5587. So that's for self-referral. We will absolutely take self-referrals. And again, once we get that information, we will contact somebody and then start the process of recommendations for what's next.
Yeah.
And aren't there already, like, if you're a cancer patient in treatment, you will get like a certain amount of complimentary services?
Yes. So we do have short-term therapy, which is one of the reasons why it's so cancer-related. And also one of the reasons why we don't often treat PTSD, because there are some things that require more treatment. We do have a short-term therapy model based on all the needs that we have. But it's a free service. Patients are able to access excellent psychosocial care through a psychologist or even one of our trainees who are getting specialized in psycho-oncology. Like I said, kind of my background was in. The therapy is free because we know it truly impacts somebody's well-being and outcomes in cancer care.
And caregivers as well.
And caregivers as well. So caregivers are a huge part of a patient's experience. They do a lot of the caring at home. That used to be more in the hospital. Now we're moving to a lot more outpatient kind of at-home care. So caregivers are doing a lot, both physically and emotionally. So yes, we do provide therapy for caregivers as well.
What if you had cancer a few years ago and you're realizing that you still have a lot going on mentally, whether you were a patient at Siteman or not? Could you self-refer? Could you call the mental health services at Siteman if you were treated somewhere else, or let's say you moved from another state?
So the services that we provide are only for Siteman patients. So if it is a Siteman patient from the past that's still coming in for scans and things like that, they're in survivorship and dealing with a lot of kind of what you've been talking about, Patrick, or reflecting and saying, oh my gosh, what happened to me? I never really paid attention to this. I need help, or I could use some support. Absolutely. Please self-refer. A physician can refer or somebody can self-refer. We do not see patients outside of Siteman, though. So if they were treated elsewhere, I would suggest reaching out to that cancer center. Or there are some other like national organizations that do a great job of supporting patients and caregivers and survivors through cancer. Those are American Cancer Society. On American Cancer Society's website, there are links to get support, and that may be like a one-on-one coaching or a group that they offer or educational materials. Cancer Support Community is also a national organization, and they do have a location in St. Louis. They do offer individual counseling sometimes, but they're typically more of a support group setting where they have every week, I don't know, a dozen different sessions that are available to patients and their families, again, specific to cancer. So that's a great support organization that is often in person, but often virtual. So if anybody across the country, wasn't a Siteman patient, that is going to still be available for them.
And what about what you would say to someone who's listening because they feel like they are trying to understand either how they're feeling or how someone they love feels? So what would you say to them? I mean, is there anything in general that you say to someone?
Well, I think the most general thing and most kind of helpful thing I could say is that it's so normal or expected to have some of these effects of cancer. It would be strange. I would be more concerned, and I tell this to patients all the time. If anybody's listening that I've worked with, they've probably heard me say this. I would be more concerned if you didn't have some of these things going on. I would be more concerned if you weren't anxious or feeling down sometimes, because that would mean you were completely disconnected. Yeah. And that's not a healthy way to live either. So it's normal, it's expected. And just because it's normal or expected doesn't mean you have to suffer through it without help. There's a lot of ways to support yourself or get support through it that may not be costly, may not take a lot of time or energy. So talk to your team, talk to your medical team, do some of that searching to find support.
So, I mean, we've listed depression, anxiety, PTSD, fatigue, pain, sleep issues, body image, feelings of fear, inferiority, feelings of guilt. All of these things are 100% normal. Mm-hmm.
That's a Tuesday for Dr. Vanderlyn.
That's right.
That is.
That's
that
right.
Is, yeah.
Right? Mm-hmm. Well, I think that I hope that people hearing this today feel less alone, feel validated. Yep. I learned a couple things about, how to be a supportive friend to Patrick.
Good.
And I again want to say I did not take it personally that you didn't tell me.
I know. You're the best.
I just care a lot.
I know you do.
And I'm sure that's how a lot of people feel that are listening too.
Yeah.
Yeah. Of course we care, right? And I think people listening to this, like you said, are either experiencing this themselves or know somebody who's going through this and just want to be a support. So it's helpful to know kind of what the groundwork is like or what the framework is here, and know that these things are probably happening to people in your life with cancer, and that's okay. Doesn't mean you have to poke and prod and ask how they're doing every day.
Right.
You may just open that door and be a person they can talk to if they need.
Right. So let's give that number one more time, Siteman Cancer Center.
Yep. Siteman Cancer Center's number for the psychology service is 314-747-5587. We have an awesome scheduler who is just lovely. So that'll be somebody's first contact with us. She will give them a call and get them pointed in the right direction.
We've talked about so many resources today. We've talked about the Siteman website, the phone number, other cancer places or other national organizations that can help. We've talked about the 988. The 988 number, and all of these things are going to be listed in this episode description. So, there's lots of ways to get help. If you're a Siteman patient, please reach out.
Please
call or have your physician refer you. And if you're not one, call
They'll point you in the right direction. Then.
Yeah, they'll point you in the right direction or to the resources that you need. And nationally, call your local cancer center and see what resources they have, because they're there.
They are there.
We just need to encourage people to reach out.
Absolutely.
Jessica, thank you so much for joining us today. We could talk about this for hours.
We really could.
Well, we'll have to have you back again then.
I would love that. Thanks
you
both.
So much.
Thank you.
Thanks for listening to This is Cancer.
Brought to you by Siteman Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis.
National leaders in cancer.
For more information on Siteman Cancer Center, go to siteman.wustl.edu and be sure to leave us a review and like and subscribe wherever you listen to podcasts.